South Africa is nearing the 100,000 case mark in the COVID-19 pandemic. Currently, 97,302 positive cases have been confirmed. The Western Cape still leads with a number of COVID-19 cases, with just over half the national total. It is followed by Gauteng at 21.4% and the Eastern Cape with 16.2%. To talk about the situation in Gauteng now, we joined via Skype by the MEC responsible for the Department of Health in Gauteng, Dr. Bandile Masuku. Dr. Masuku, good afternoon to you. Thank you so much for coming through.
Good afternoon, and good afternoon to your viewers, and thanks for having us.
Thank you so much indeed for coming through. Now, the city of Johannesburg continues to record the highest number of COVID-19 cases in the province. What plans have you perhaps put in place to ensure that the numbers sort of go down or stabilize?
No, I think we've been doing quite a great deal in terms of containing and making sure that we're able to trace and contacts of those of active cases. The only thing that has been a big deterrent for us is just the involvement of the CBD and the involvement of informal traders in the CBD. And we also had a very small outbreaks which followed the religious festival that happened 2 weeks ago. So now we are faced with that particular problem, but contact tracing and testing of those individuals who were in that space have actually went on quite well in that regard.
But let's just talk about your plans really. How prepared is the province, Dr. Masuku, to deal with the surge of COVID-19 cases? We had the minister on the channel this morning who is very concerned with the high number of COVID-19 cases that have been reported. So Gauteng being the second epicenter of the country, what preparations do you have in place?
I think we've been doing a lot of preparations, and I think we'll only be able to tell you in a concrete way of the success of the preparations post the pandemic. But what we are doing continuously is just to continue to put up extra beds. Now we are looking at the possibility of putting extra hospital beds in Nasrec in field hospitals and putting up other extra field hospitals across the province. That's just in case where we are going to run short of our general ward beds that it might be needed going forward. But plans are underway to put up those extra field hospitals across the province.
And some of my producers and I were talking about these hospital beds and the field hospitals. I think that's what you call them. There is one just opposite us here in Nasrec. So are they already in full operation, or are you waiting for perhaps for the time where they will be needed to be used when we see the surge in the cases?
Yeah, the principle will still be the same, that those who require critical care and who require close attention and monitoring will still be seen in our ordinary, ordinary facilities, hospital facilities. And those who will go into field hospitals are those who are going to be less sick and who will require less attention from from the doctors. So we are looking at it in that way, that the most sick will still be seen in our traditional hospitals like your Chris and Baragwana, Charlotte Maxeke, and all the others, and those who are now better and maybe who just needs a proper monitoring after their sickness will go to the field hospitals. Currently, Nasrec has started functioning. I think we are still very under 5% bed occupancy at this rate.
All right. So we've already spoken about the city of Johannesburg being the highest when it comes to the confirmed positive cases in the province. What other areas have you identified as hotspots in the province?
Yeah, you will remember that it has been a rolling problem, and hotspots do shift from one week to another. We are also worried about Ekurhuleni, and very much worried about what is happening in Sedibeng, because in a very short space of time, in a period of a month, we have seen a very high number of infections actually happening around Sedibeng area, which is the Val, and it's something that we are of concern of, and also even caught up the number of deaths that they've had in the last a month or so. For the past 3 months, they've been having one death, but now they're almost at 12, which is of great concern, which we are zooming into in the current space.
MEC, the province has recently raised concerns about cluster outbreaks, especially when it comes to funerals. So what have you observed? What has the pattern been?
Remember, our problem with the cluster outbreaks is that it's the numbers that of potential people who can get infected in a short space of time, and those people can then carry the infections broader. So when we limit the number of mourners, for example, it also limits the number of those people who can potentially get infected. But it's something that we have seen and that is continuing to happen, including the outbreaks that happened in Johannesburg. They were also not maybe around funerals, but they were all around gatherings that occurred after, that field, that ritual festival of, of religious nature. So that's what we are actually dealing with. So that's the observation, that the numbers themselves, they do drive the rapidness of the infection.
I think it was just last week when the province recorded, over 3,000 cases in just 11 days of the level 3 lockdown. So are you worried that a lot of new cases were recorded and they in fact came with the easing of the lockdown regulations?
Yes, I think it is a worrying factor, because it also tends to counter the work that we're doing in terms of preparations, in terms of the tracing and tracking of many of these infected individuals. So it is a worrying factor, but also we also have to note that in the coming 2 weeks from last week, we are going to be catching up with the backlogs of the specimens that have been actually waiting to be tested. Because of in the past 2 weeks, Western Cape was prioritized. Now, Gauteng is prioritized, so that we get rid of the backlog, so that we know in terms of the numbers that we are actually dealing with the current infection rates, not actually historical and retrospective rates.
And I see that from the latest release issued by your office, we have confirmed cases, 20,822, and we're only looking at 5,306 recoveries in the province. Are you worried, or are you hopeful that you are on the right track?
The issue of recoveries, you can see that they are quite low, but the numbers of cases confirmed are higher. So that is the reason why we are saying that we need to get rid of the backlog. Because when we get rid of the backlog, we'll be able to have what is actually currently happening, not in a retrospective way. Because those numbers that we are getting, you can find that some of them, in terms of age analysis, they actually fall in the category of actually those who have been recovered. So it's something that we want to get rid of, so that we are able to stabilize and harmonize in our data in the province.
And stigma continues to be a problem. As the city, as the province, what awareness programs are you perhaps doing to educate the public about the virus?
Yeah, we are launching a campaign, or we did report about it, the word-based approach that we spoke about, which we are doing with the Department of Cooperative Governance and Traditional Affairs, where we are taking the whole awareness into word-based to make FBOs, like your first-based organization, lead the campaign, councillors be part of it, because we also realize that it's so important that enforcement of regulations, particularly these regulations, can only work if the community is mobilized around those regulations, and they can be able to enforce and actually reprimand each other, than to expect the police themselves to be involved. So the stigma on its own is something that we have done quite a lot, with it. From the side of the media, I think the education has been quite great, and the involvement of the media in that space, and we should continue doing that.
All right, so just in conclusion, very quickly here, MEC, Gauteng continues to receive donations from the private sector. What does this say about the private-public partnership and perhaps the private sector commitment in the fight against COVID-19?
We actually, welcome the partnership, and we call for more of organizations and companies to be involved in donation and giving, particularly, donations of this nature, which will help us to add up on our stock for PPE, able to protect our healthcare workers, because they are a priority in this regard. We need to make sure that when they go and confront the pandemic, they go there fearless and with less anxiety. So we are calling upon all the partners and all the companies to come on board and help us to be able to give more of this PPE to make sure that we protect our healthcare workers. And we should appreciate the work that is done by our healthcare workers every day, risking their lives and putting their life in danger, all in the name of serving, and which is something that is quite appreciated from the side of government, that we also have to pay homage for those who have lost their lives in the process.
All right, MEC, time constraints. That's where we'll leave it for today. Thank you so much for coming.